Hello everyone. So today we will be discussing about the teratogenic drugs. Okay, basically after the troubleshoot series we have come up with 10 liners. What are 10 liners? For every chapter I will be giving you 10 lines. Okay, and if you have able to understood this 10 line, it means your each and every question will get correct. Okay, and if you are not able to understand any one of the line, then you have to go back to the video and you have to listen it. Okay, it means the whole chapter will be, all the chapters of the obs and gynae will be concised in 10 line. As you all know that in teratogenic drug there is nothing to understand, so for teratogenic drug I am giving only the 10 liners. Okay, because this drug if taken in this pregnancy and it will cause this things, so there is nothing to understand. It is all about to learn those. Okay, troubleshoot series and 10 liners both will go simultaneously. Okay, so let's start it. First of all, let's see warfarin. Warfarin is one of the teratogenic drugs. Okay, and by the intake of the warfarin during the first trimester, it is not so teratogenic. It is only banned in the first trimester. Okay, and when the pregnant lady takes this drug in the first trimester, then it causes chondrodysplasia punctata. Okay, chondro means cartilage and dysplasia means ढंग से ना बनना. ठीक है, so that is why it happens chondrodysplasia punctata. Okay, and another name is Condrati syndrome. So by name also comes the malformations also come. Now because the warfarin causes warfarin embryopathy or chondrodysplasia punctata, that is why we give heparin to the patient in the first trimester, because heparin is a large molecule and it does not cross placenta. Both low molecular weight heparin and the unfractioned heparin both do not cross placenta. Okay, and after first trimester, patient again start taking warfarin instead of heparin. Okay, now this was it. That patient has again started taking the warfarin after the first trimester. This warfarin is again replaced by heparin at 36 weeks. Okay, because warfarin has a prolonged effect and heparin has a very short effect. That is why the warfarin is replaced by heparin at 36 weeks. Okay, so that no bleeding occurs during the delivery or cesarean, whatever will happen. So that is the fact, number one. Number two, you have to remember that if the patient has prosthetic walls, okay, then in the second trimester we are giving warfarin. In addition to warfarin, we have also to give aspirin. Okay, in the second trimester we are giving the patient warfarin. In addition to warfarin, we have also to give aspirin and another blood thinner. Why? Because the pregnancy is a hypercoagulable stage, so we have to give somewhat more than warfarin if the patient had mechanical prosthetic walls. Okay, done. So now let's see about the another teratogenic drug, lithium. Lithium causes Epstein anomaly. So what is Epstein anomaly? In the lithium, due to the lithium intake in the pregnancy, the ventricle gets short. Okay, and that is why the right ventricle gets small. It is formed small. It is not formed of normal size. The right atrium, due to the hypertrophy or hyperworking, it gets large. Okay, so this is known as Epstein anomaly. Okay, and it is such a teratogenic drug. It is much teratogenic, that is, it is contraindicated in lactation too. Okay, so now let us study about diethylbistrol. Diethylbistrol is nothing but it is estrogen. Got it? Diethylbistrol is nothing but it is estrogen. Okay, as these days we give the patients progesterone when they are in the they are having the threatened abortion. In the previous days we used to give the patient estrogen and progesterone both. Okay, 6-7 years back we used to give the patient both estrogen and progesterone. Okay, so now when we have given the estrogen to the patient, we find that there is some problem in the that there is a problem in the internal genital tract of the female, and the external genital tract of the male was affected, male fetus was affected. So what was the changes found in the external genital tract of the female? That there was vaginal clear cell adenocarcinoma. Okay, so this was a question in INS set, so I will say you that please learn it by heart, that vaginal clear cell adenocarcinoma occurs. Okay, and vaginal and cervical adenosis occur. Okay, T-shaped uterus occur. Uterus T-shape means its cavity is just like all of you have seen copper T, just such a thin cavity. Okay, and fimbrias, they are absent. This is the characteristic of the female. And in the male, there is cryptorchidism, testicular hyperplasia, hypospadiasis. All these changes are in the external genitalia, and in the female, all the changes are in the internal genitalia. Okay, so this vaginal adenosis, cervical adenosis, T-shaped uterus, and vaginal clear cell adenocarcinoma. So clear cell is the most malignant carcinoma among the adenocarcinoma, most severe carcinoma, you can say. So you all have to learn this name because it has come in INS, it can come to you also. Okay, and there is absent fimbria. So this hypospadiasis had come last in the 2016. So you have to learn hypospadiasis, phimosis, testicular hypoplasia, cryptorchidism occurs in male fetus. Okay. Let's go to the next drug. The next drug is carbimazole. Carbimazole or methimazole, these are anti-thyroid drugs. Last time in the FMG it come in your exam that which drug is safe when a patient is having hyperthyroidism. So propyl thiouracil is safe. Okay, what will happen if the patient take this drug? Choanal atresia. Choanal atresia means these nasal opening, they are closed. Okay, and what is aplasia cuteus? Aplasia means absent and cutis means skin. So skin is absent at some areas of the fetus, especially the scalp skin is absent. Okay, but PTU, propyl thiouracil, is safe. Okay, indomethacin. Indomethacin is a prostaglandin synthetase inhibitor. It causes the premature closure of the ductus arteriosus. Okay, and it is also used as a tocolytic agent before 32 weeks. It is not given after 32 weeks because it causes premature closure of ductal arteriosus, and it is also used in the treatment of polyhydramnios. Okay, next drug is isotretinoin. It causes a lot of anomalies. It causes CNS anomalies. In the CNS, it causes NTD, it causes CVS anomalies, it causes facial defects. All this it causes. Alcohol not only causes behavioral problem, it causes cranial, that is, it causes mental retardation, it causes heart disorders, and it also causes IUGR. All type of addictions, they causes IUGR. Okay, smoking causes only IUGR, no other effect. And cocaine, it causes generalized vasospasm in the mother and fetus both. So it causes cerebral infarcts, it is a vasoconstrictor, and microcephaly. All this it causes. Tetracycline is the most least, it just causes discoloration of the decidual teeth. SSRI, they causes pulmonary hypertension and behavioral defects. Okay, here are some more drugs whose syndrome you don't have to learn, but you have to learn that they are teratogenic, because they give all are teratogenic except valproate, phenytoin, the anti-epileptics, including the carbamazepine. I have not written the carbamazepine, but yes, carbamazepine is also teratogenic. Diuretics are teratogenic. All the diuretics are teratogenic. ACE inhibitor, or you know that ARB, they are teratogenic. Androgens and danazole, these are steroids. They cause muscularization of the female fetus. They make the female fetus with male genitalia because increased exposure of androgen. Anti-neoplastic drug, methotrexate, all the anti-neoplastic drug, they are contraindicated because they don't let the cells to divide. Okay, safe epileptic in the pregnancy is Teracetam. It is very difficult to remember. I just remember it. Le bhi teri Sita. Okay, Lakshman ji has taken the Sita. So, Raman ji has taken the Sita. So, now when Raman ji came, was giving the Sita, they say, Le bhai teri Sita. Okay, thalidomide is a drug which causes phacomelia. First, this drug was banned. Okay, it causes large pain relief in the pregnant woman, but now it has come for the treatment of the cancer pain. Now they say that don't give this drug in the pregnant lady, but give this drug for other pains. So for the cancer pain, last stage of the cancer pain, this drug is being given, and this drug is also given in the patient of leprosy, thalidomide. Okay, and as already discussed, all the addiction drug, including the smoking, it causes IUGR. Cocaine causes vasoconstrictor, that is why it causes cerebral infarcts, and alcohol causes CNS problems, CVS problems, and behavioral disorder, and IUGR, all this three. Okay, that was all about the teratogenic drug. See you soon in the next video. Please like, share and subscribe my channel. It will help me a lot in my teaching journey. Thank you.